busy schedules to join us today for this, what is a fourth in a series of summits that we in Snohomish County are hosting around the competitive areas of the economy in the Puget Sound region. The first summit we tackled was in January, and that summit was focused on the building industry, recognizing the decline in that industry and what we could do in the region to help spur development. A little too hot there. To help spur development and hold on to some of our companies that have created jobs and opportunity in this region. The second was on entrepreneurialism and high tech, recognizing that this region in Snohomish County and the Puget Sound is one of the more dynamic regions in the country, and that its growth over the past 12 years was really based upon individuals with great ideas, new technologies, and taking the technology transfers from our universities and growing small startups. In fact, Snohomish County's economy was led by that sector, second only to aerospace. And the third, of course, was aerospace, because we are home of the best airplanes and workers who build those airplanes in the world. And that summit was called Saving Aerospace. That summit was focused on what we can do in the region to advance opportunities to keep the second line of the 787 at the Boeing Company, but also to advance the supplier market, which has, generated over 45,000 jobs in Snohomish County in the past 7 years. Now, the fourth summit is here today. This is on healthcare reform, and what we as individuals can do, both businesses, healthcare providers, patients, and administrators, to make certain that we take control of our policies and improve the health of our community. Now, in a minute, I'll introduce Mary McWilliams, who is the Executive Director of the Puget Sound Healthcare Alliance, which we in Snohomish County are a partner in. Why are we having this summit? Why is this conversation on healthcare today? Well, this is not the conversation on healthcare that many of us have seen on TV. As I walked in, I made certain there were no Tea Party protesters outside. We have no town halls scheduled for this topic. We recognize, however, that the issue of healthcare is an important one, and it's one that's being widely debated right now in Washington, D.C. In fact, it's capturing everyone's attention and interest. The conversation today really is more around what we in the region are doing to increase quality, increase access, but also take control of our policies. And what I mean by that is that healthcare, I think as it has evolved, for many of us, is a service. And it's really no different than any other service that we pay for from our pocket. In many cases, we have a policy. We own that policy. We own that service. We've built a relationship with our provider. They know us, we know them, they know what we need because we tell them what we need. And that really is the model that I think we're going to see healthcare go towards over the next couple of years. And in fact, if you're watching the healthcare debate, which I know many of you are, and you listen to our Senator Maria Cantwell, one of our senators, Maria Cantwell, she speaks as to the efficacy of the system in Washington State and how the federal system needs to model what we've done in Washington State, providing patient accountability and patient choice, doctor accountability, cost controls, and improvements in that system. In fact, she's working language into the federal bill that replicates a lot of what we're doing well here in Washington State. As an employer of almost 3,000 people, I can tell you that we can have conferences and summits on the most dynamic issues in the region. We can talk about how we grow our economy. We can take the natural steps to do that. But if we don't have the people able and willing to march down that road and carry forward on the goals that we set as private and public employers, then our goals will not be achieved. We have to have people that work with us who are healthy. Their families have to be healthy. They have to be able to engage in life, both on a professional and personal level. And that is why healthcare is just as critical that comes up in these summits as education, as workforce training, as taxes, as regulatory reform, and investments. Because human beings are our greatest asset in every single thing we do. Now, why do I believe, as the county executive in Snohomish County and a partner of the Puget Sound Healthcare Alliance, that we own our healthcare policies? Well, I think a lot of us have seen changes in healthcare over the last couple of years. The conversations about who your doctor is and what kind of care you can receive has changed. The dialogue and the respect between patient and provider has also changed, and I think that's a positive. In my personal example, I can email my doctor with whatever I'm feeling. I can ask him questions, and he responds right back to me. It's not like the old days where I would have to go in and do the things that I always did, get weighed, have my heart checked, do all those wonderful things that we remember growing up. It's a different, more professional relationship. My personal belief behind healthcare and why you own it is real simple. Now, I'm 38 years old, father of two, married to my wife, Kate, for almost 14 years. When we had our second child, Jack, back in 2006, my wife and I were in Arizona, little vacation, and about 5 o'clock in the evening, I was absolutely out of breath. How many of you have children? So you know exactly what I'm talking about. They wear you down. I have somewhat of a stressful job, and I did not realize that I had kind of let myself go. You're busy, you're focused on your job, you're focused on your family, and you tend to lose energy. You tend to be less effective at what you do. We all know how that feels. But my wife, being the wonderful, honest woman that she is, as I commented about 6 o'clock in the evening, I said, honey, you know, we're going to have to put these kids down about 3 o'clock if they keep wearing me out. And my beautiful, lovely, caring, love of my life wife looked over and said, well, if you just lost about 40 pounds, you might have the energy to stay up till 8. She was absolutely right. Absolutely right. And what I did the next day, is I woke up before she did, went to the hotel gym, and I didn't stop. Now, it's different, as you all know, in healthcare. It's not as easy as it sounds. It's not as easy as just living right, eating right, and being active. You have to know what you're doing. You have to have a relationship with the person who knows the science behind what you're doing as well. And so I contacted my doctor, and I told him, look, I want to lose some weight. I want to feel better. I want to be active again. I want to be able to live an active lifestyle. I want to be able to go do things with my family and not run out of gas all the time. And at that time, I was only 36. I said, look, I want to lose some of this weight. I just feel a lot older. He said, well, you are a lot older, and you will continue to get older, but there are things that we can do. And through that relationship with my doctor, him knowing the science, me having the desire to live a healthier life, everything changed. And, you know, I weighed 221 pounds. I had a body fat of 21%. I wore it very well. I still looked pretty good, I thought. But I had absolutely no energy. And it was through that relationship that in only 3 months' time, I had down to 10% body fat, and I weighed 182 pounds. Anyone can do that. I realized what it was science. It was communication with my provider. My lipid count went down, my cholesterol went down, all the bad things went down, all the good things went up. And through that conversation, I've been able to maintain for the last 4 years a healthy, active lifestyle that I wanted. I took control of my healthcare policy. My doctor knows how serious I am about wanting to be around for my kids because my family is not the healthiest family. My genetics are against us. And he knows that. And we all know that that plays a key role in how healthy we're going to be going forward. Now, what we're talking about right now is not the typical medical talk. It's not the typical patient-provider communication that we're all used to. But it really is the medicine of today. It's the healthcare of today. It's having your doctor know about you. You know what your doctor needs to know, knowing your history and your family, and knowing what you need to do and taking responsibility for your life. And I think that that kind of communication, whether it be wanting to live a healthier life, recognizing that genetics aren't on your side, recognizing how to improve overall quality, recognizing who the best provider is in your area, and are they up to date, and are they managing their costs well? That's all information that we can acquire. That's all information that we can share. And those are services that we can translate directly into patient-provider services, not something that's more based upon a research document.